I'm joined by Dr. Chad Wetterneck, who is Clinical Director of Trauma Recovery for Rogers Behavioral Health. Dr. Wetterneck, we keep having these horrific events, and it leaves parents and other caregivers in a tough spot as they try to provide support for children. What advice would you have?
Yeah, there's a lot of guidelines that we can give that I think will be helpful for people. And what it comes down to is making sure that we're actually talking about it. So whether your child was at an event, heard about an event, maybe saw something on the television, make some time to actually talk with them. They will likely find out through other media sources what's going on and get part of the picture, but you'd like to help shape what that narrative is. So think about what you might want to say to them. Find some time where there aren't any distractions around. So, it might mean setting down a book or a video game, turning off the television, and just saying, let's make even 5 or 10 minutes to talk about this. Find out what they know already. Um, you don't want to just tell them what happened, but also, did they hear anything? And was some of it misinformation? And a large part of how we deal with these traumatic events is making sure that we are open with our feelings and that we can model that for our children as well, which means you should share your feelings with your child or the person you're speaking with. That will provide them with a model to show that it's okay for you to feel. It will appear more genuine. It will show them what they could do in the future if they actually needed to talk about it because their feelings were strong and wanting to come out. And above all, make sure that you're telling them the truth, because if they hear something different otherwise, um, it's going to send the wrong message, obviously, to them. And reassure them that even though these things seem as though they're increasing in frequency, that for the most part, they are safe. That most of the time, these things do not happen. And it's not something they have to worry about every time they leave the house.
How do you think the emotional state and response by adults affects kids and how they respond?
Well, kids are perceptive and they learn from us even when we don't think that we're trying to teach them anything. They're going to model and see how we interact with each other. Are we avoiding talking about things, especially things that have a strong emotional component to them? Does that teach them that it's not okay to talk about emotions? Likely, or that they need to find another outlet for it. So, of course, if we felt very strong emotions about it, perhaps we knew someone in one of these incidents, or we were thinking about it happening to us. Um, it could be quite overwhelming, and I know some people might not want their family or loved ones or children to see them in distress. But that would be a sign that maybe you do need to talk to someone about what's going on with you. But I still wouldn't hide overall the fact that it is emotionally moving for you to be close to one of these events or considering it happening to you or your family.
That makes sense. This is clearly a traumatic event. For those who are directly involved, how high is the risk of PTSD, and when might it present?
Mhm. Well, it's really different in every situation, but for those folks that were there as witnesses, or maybe even they got injured, um, most people don't go on to develop PTSD, and that's the good news. And that's part of what we like people to be aware of is most people might develop some symptoms, but it doesn't mean it's going to turn into a disorder that could, forever change their life. However, for about maybe up to a quarter of people that are directly affected by this, they that would be my estimate of folks that could go on to develop PTSD if they didn't take some precautionary steps or potentially even see a specialist if they were dealing with pretty difficult symptoms.
And what kind of precautionary steps do you recommend they take?
Yes, so similar to the advice that I would suggest for parents or other loved ones talking to children and adolescents, you apply those same rules to us as adults. And that is make sure that you're talking about it. And I'm not saying talking about it for talking about its sake, but when we feel very afraid and helpless, we often try our best just naturally to not want to think about that or feel those feelings. That doesn't allow us to process them at all. It doesn't allow us to change our relationship with them. And if we leave feelings of fear or helplessness as signals for intense danger anytime they come up, that's normally more of a breeding ground for PTSD to develop. So some of the things that you could do are make sure that if you aren't regularly talking to people that you find supportive. It's to think about who are some of the people that I think are good listeners, might give good advice, might be able to show me some compassion or support, and make sure that you're reaching out to them about it. Um, as these cases tend to unfold as well, we find that there's new information, sometimes available every few minutes, every few hours, and then definitely after the days to pass. We want to make sure that people aren't checking in to any type of media to get updates so regularly that they can't allow their mind a break from thinking about these events as well. So some of my advice is to make sure that you're not over attending to what's going on in the news. All of this really, though, is in the service of making sure that you are willing to explore and think about how you feel. We should acknowledge these feelings. As I've said, they're quite normal, and I wouldn't want you to consider yourself, harmed in some way because you felt fear while experiencing this event, or maybe even watching the video of it. Um, but it's also a sign to make sure that you're doing things that can function as self-care for you. And self-care isn't avoiding things that are difficult. It's making sure that you have time and space to be able to process them as they come up.
And does that same advice apply to those who are directly affected, or maybe just people who live in the community, and those who just are watching the aftermath of these kinds of events in the news?
Yeah. I think just as general advice that can be helpful for all. I do expect, though, that folks who were more directly involved in any type of traumatic event, including these shootings, they were on the scene. If they saw injuries, if they had injuries, their likelihood of feeling more intense fear or helplessness is going to be elevated. For folks that got news of it, watched a video, read about it, it may interact with any sort of previous traumatic experiences they've had. So that would be something I'd be aware of as well. Usually, folks that aren't there won't be quite as affected as others, but you can't rule out that it might not activate other experiences they've had and require them to actually go in and talk to a professional about it.
And what kinds of signs should people be watching for? And do those differ by age in terms of signs of, impact of
Sure.
trauma or
Sure.
actual PTSD?
Yeah, and I think there's going to be, changes in many of our important areas in life, and that could be how we think, how we feel, and then also what we do. So in terms of how we think, um, we might have more thoughts about bad things happening. We might have a little bit more sense of, questioning how long life will last for us, um, because some people just lost their lives unexpectedly. In terms of our feelings, people could show a range of signs. It could be increased sadness. It could be increasingly on edge and anxious. It could look like they're feeling down. Other people might be perceived as irritable. And that's really their anxiety and emotional systems on edge and leading them to have kind of like less resources to deal with challenges as they come up. And then behaviorally, people may, and this makes a lot of sense, change their behaviors in the short term. They may not go out as much or go into similar situations that they had planned on going. Many of these situations, especially shootings at a Fourth of July parade, or the incident that happened in Waukesha, those are things that are supposed to bring joy to people, and foster a sense of community. So on one sense, while they're avoiding them, they're also not getting the benefits of some of the activities they were going to participate in, which can lead to an increased sense of feeling down. Um, it can cause people doubt in their trust in themselves and others. Really, there's just general sense of uncertainty, and most of us would like the world to be a little bit more predictable, and it really shatters our belief of why gun violence happens, why who gets targeted by it and who's actually affected by it. With children, it really it depends on their age and like their developmental level in terms of um, how aware are they of their own emotions, how aware are they of their own thoughts. And the younger that you are, you might just see that there might be more either isolation or acting out behavior. So it can kind of be either extreme of um, engaging in people in less functional ways or maybe avoiding people altogether. And of course, all the other things I described are possible as well.
And when do you recommend seeking professional help?
Yeah, that's a great question because we want to normalize that after an experience like this, most people would be afraid. Even if they weren't there, it causes them to think two or three times about the next time they're going to step out by themselves or with family. And there isn't a perfect guideline for this. But if some of these shorter term strategies, emotional experiences, changes in behavior, um, changes in the way you think about the world, seem to be kind of taking root and lasting for months, but definitely if it's for years and it's greatly changing your ability to engage in life and your quality of life, you should reach out to someone that has professional experience in working with trauma and or PTSD and see how they can help you.
Great, great advice. Thank you. One final question. For those professionals, whether it's social worker, therapists, school counselors, even summer camp staff who are working with kids or adults who are traumatized by all these events, there's a risk of compassion fatigue. And what advice do you have for them, as well as what they can do to take care of themselves?
Yeah, I think we've seen some of the greatest strain on all types of health and mental health professionals in the past few years. When we have these interactions of violence, unexpected death, and COVID, and some of the isolation that came with that. So this is a really big challenge for us. Um, all of the folks that are in this field have to recognize that even if they're more needed than usual, they still have to do at least the same amount of self care that they were doing before. And if they weren't doing self care, they need to do so even more than ever. And when I think about self care, many people might think that's, well, not working and not being at work or taking work home with you. And I think that's only part of it. I think it's also making sure that you do activities that seem meaningful and fulfilling to you outside of your work life and how you perceive yourself in that area. It also means that if something comes up, like a challenge from your work life, and that might be feeling emotions or it might be like feeling I don't have compassion to give anymore, it's to do some work to try to process that as well. And sometimes that means going and seeing another mental health professional and making sure that you talk about them. But at minimum, I think it means staying connected to other people that you could find supportive. And for some people, it might be forming their own group of health professionals who get together weekly or monthly to make sure that they're checking in on each other and see how they're doing.
Thank you so much, Dr. Chad Wetterneck. We appreciate all of your advice and insights. Thank you.
Thank you, Anne.